Hello, everyone, and welcome to today's webinar, Training Through Treatment, Fitness and Movement After a Breast Cancer Diagnosis. My name is Legine Austin, and I am a patient advocate working with the Dr. Susan Love Foundation for Breast Cancer Research, and I am also a breast cancer survivor. For those of you who are joining us for the first time, I'd like to take an opportunity to introduce you to the organization. The Dr. Susan Love Foundation challenges the status quo to end breast cancer through innovative research and improve the lives of people impacted through education and advocacy. The foundation drives collaborative, cutting-edge research with non-traditional partners, sheds light on the collateral damage of treatment, and actively seeks ways to diminish it, and interprets science to empower breast cancer patients. Many of the projects the foundation undertakes are designed to increase our understanding of the human breast, where breast cancer starts, and what enables malignancy to occur, with the ultimate goal of developing methods to prevent it in the first place. The foundation is also committed to participation in research that has the potential to positively impact the lives of all people who are at risk for or who have breast cancer. Breast cancer happens in people, so research needs to be done on human beings, and that means men, women, non-binary people, everyone who gets breast cancer. Our Love Research Army is committed to encouraging and facilitating breast cancer research in all people, regardless of age, race, gender, sexual identity, with or without a breast cancer diagnosis. We are committed to thoughtfully engaging our members by providing them with ongoing real-time access to an array of studies. Today's webinar is part of the patient education series where we invite researchers and patient advocates to provide helpful resources and information for our patient community. Joining us today are three panelists, each of whom are going to give a brief presentation. To begin, we have Dr. Stephanie Graf. Dr. Graf is an accomplished physician who is board certified in medical oncology, hematology, and internal medicine. Dr. Graf has a strong background in cancer treatment. In addition to supporting the Dr. Susan Love Foundation as one of its medical advisors, Dr. Graf is the director of breast oncology at the Lifespan Cancer Institute at Brown University.
Thank you. I feel like for this topic, we should also say Dr. Graf works out every morning at 5 a.m. before work and thinks exercise is really important for our health and well-being mentally, physically, and emotionally. So I hope you all enjoy our topic today. Next slide. I just wanted to create space to say a bunch of stuff that's not going to be covered other places. And so this is my things unsaid slide. First is that I know that many of you, if you're on this webinar as a patient, as a survivor, as a relationship to the cancer community, you may never have heard your doctor talk to you about exercise before. And as a physician, I want to say it's really hard because we only have 15 minutes a lot of the times in the course of a follow-up, and we have to talk about your chemo and your scan and your blood work and your side effects. And we also want to work in a little bit about you and hear about what's going on in your life and what's new or different. And so then to pile onto that, here's what healthy diet, exercise, lifestyle looks like is really hard. And so if you have questions that haven't been answered or specifically need information, ask your doctor. And they may not be the one that does it. They may refer you to physical therapy or wellness champion in your system, but they will connect you with resources as well, in addition to what you'll learn today. Second thing unsaid I want to make sure we cover is there's rare situations where maybe, you're going to hear all of us enthusiastically endorse that exercise fitness training throughout any time point in a diagnosis of breast cancer is safe and appropriate. The few rare situations are if you have a very, very low platelet count, because you could have muscle injury or falls that led to bleeding, and that's unsafe. That's pretty rare outside of aggressive chemotherapy, and chances are you would know that that was happening to you. Number two is if you have metastatic breast cancer that has spread to certain bones. And I don't mean in every situation. Metastatic breast cancer that has spread to the bones is a safe situation to exercise. But what we want is those bones to be what we consider stabilized. So I'm going to use the example of if you have breast cancer that has spread to your hip bone, that's a weight-bearing joint. Your hip is really important to jump and walk and move. And so if there is cancer that's encompassing a large percentage of the bone, sometimes will radiate, sometimes orthopedic surgery will even get involved and place, pins or something to help keep that joint stabilized. So if you have disease in your bones from your breast cancer, you want to make sure that those bones are safe and stabilized. And you can ask your doctor, are my bones stable enough for me to exercise? It should be a yes or no question. And if not, you probably also know because they're probably painful and giving you symptoms. Third is that the situation is if you have neutropenic fever. So if you're on chemo and you're sick, if you're having a fever, you feel bad and you have my permission to stay in bed and take the day off from exercise. And then my last thing I want to just cover outside of doctors are busy, ask them if they haven't talked to you, and rare situations is just the overarching message of common sense reigns supreme. It's totally safe to exercise, but if you've never run a marathon, tomorrow's not your day. It takes time to work up to that. If you've had a big axillary surgery, you're not going to bench press 350 pounds tomorrow. You have to work up to that. So listen to your body, start slow, start low, go slow. Those are messages that Nicole and Tammy are probably going to reinforce well as they're talking. But again, common sense reigns supreme. Next slide. Just a quick overview. The national guidelines say this too. Exercise is really good. ASCO, the American Society of Clinical Oncology, says that adult cancer survivors who are tired, and I know that's like a kicker, right? Like who isn't tired? I've never asked a patient if they're tired and have to be like, no, I've got loads of energy. Cancer patients who are tired should get 150 minutes of moderate exercise per week with an additional 2 to 3 strength training episodes a week. That's our official recommendation. And exercise is different from just, I have lots of people that are like, oh, well, I get tired doing my laundry. That is not exercise, that's just living. We want exercise on top of living. ESMO, which is the European Society of Medical Oncology, same guidelines. So this is repeated around the globe. Next. And you'll hear us talk about all different sorts of exercise and all different sorts of benefits. And we can say that because the research says that. So there are research trials that look at just patients with breast cancer, patients with breast and prostate cancer, patients with breast, prostate, and a bunch of other types of cancer. There are trials that look at walking, bicycling, resistance training, deep water aquatic exercises, combined exercises using all of those different approaches. There's one trial that says patient's choice, like you get to decide what you're going to do. There are trials that look at 6 weeks programs, 6 months programs. So everything in between. There are trials that look at training during treatment, after treatment, prehabilitation, so before we even start treatment. And all of those show a benefit to exercise. And those benefits include things like decrease in fatigue, decrease in emotional distress, decreased sleep disturbance, improved functional capacity, like you can do more, you feel better, better quality of life. You're saying, God, my life is just better since I started working out. Weight loss, sign me up, and improved musculoskeletal pain. So all these different things can be endpoints of exercise. Next. Additionally, some of you may be joining this webinar and not have a cancer diagnosis, or be looking for a really good reason to recruit your friends or spouse, partner, kids to exercise with you so that you've got that built-in support community. The good news is exercise also can prevent cancer. So exercise provides modest protection against most cancers, including breast, but also GI malignancies, bladder, kidney, lungs, stomach, esophageal, prostate, endometrial. I listed prostate twice maybe. And for when you compare the most active patients to the least active people, for example, exercise reduced the risk of colon cancer by 27%. And in another trial, highly active people reduced the risk of breast cancer by 14% and colon cancer by 21%. And that's not even talking about other things like diabetes, heart disease, and stroke, which as a cancer survivor, we're also worried about our risk of cardiovascular endpoints. We're also reduced with regular exercise. Next. Lastly, not only will exercise do all those things about making you feel better, but it will also save you money and doctor visits. So in a publication that was actually just published the 1st of April, patients with early stage breast cancer, stage 1 or stage 2 breast cancer, were randomized to either exercise or control. They weren't discouraged from exercise in the control group. They just didn't get like the dedicated, intense resources of wonderful people like Tammy and Nicole. And patients in the control group ended up having more money spent on their healthcare and higher healthcare utilization, which is doctor slang for going to the doctor, meaning more trips to the ER and more unscheduled outpatient visits in the cancer center than what was otherwise a part of their original cancer care plan. And I have yet to meet a cancer patient who feels really financially healthy as they go through their cancer diagnosis, or who's like, wow, I wish I could spend more time in the cancer clinic. So I think that is really compelling data for why exercise is better. And I see there's some questions in the chat, so I'll work on answering some of those. Next slide as we pass it over.
Okay, thank you, Dr. Groff. We appreciate that. Our next presenter is Nicole Gleason. Nicole is the program manager of the Be Fit, Be Well Cancer Exercise Program at the University of Colorado Anschutz campus. She received her Bachelor of Science degree in Health and Exercise Science from Colorado State University in 2006. Nicole has 14 years experience working in the health and fitness industry, from managing high-end government fitness sites in the DC metro area to overseeing clinical patients in a hospital setting for cardiac and pulmonary rehab programs, as well as working with outpatient physical therapy. Nicole has worked with hundreds of cancer patients over the years with Be Fit, Be Well, and finds great joy in being able to bring some hope and relief to every one of them through teaching them the power and benefits of exercise. Nicole?
Thank you so much. I'm so happy to be here. So I'll kind of move on to the next slide right off the bat. I first want to just point out kind of who exercises. We all know that exercise for general healthy population people is something that's beneficial. But it hasn't been until recent years, even since my time graduating from school until now, that we've really discovered the benefits of exercise in a cancer population. And I'll get to these slides later as far as like benefits of exercise and kind of comparing that with side effects of treatment. But in the United States currently, 23.2% of US adults meet recommended requirements for both aerobic activity as well as muscular strength activity. So not a great number. 25% of adults are considered physically inactive, in that we're just sedentary most of our day, whether that be at work and or in our social life. And 60% of adults do not engage in recommended amounts of physical activity. So I just want to point out those numbers because upon a cancer diagnosis, the last thing sometimes people think of is like engaging in exercise. You've got a lot on your plate, and the thought of exercise can be really daunting when you're feeling terrible and your side effects are kicking in, fatigue, nausea, etc. Hopefully some of the points that Dr. Graff and myself and Tammy highlight over the course of this presentation really prompt you to think about exercise in a different way. And as Dr. Graff said, start low, go slow. Baby steps are the best place to start. Often we recommend patients just to get out for a walk. So I just want to make note of that, that you don't have to jump into a formal exercise program in order to receive benefits of exercise, there's a lot that you can do to kind of build yourself up to getting to a place where you can do multiple days of exercise and or strength training in a more structured way. I also found this study led by Memorial Sloan Kettering. Researchers found that 75% of people that were diagnosed with cancer reported a reduction in their physical activity. So we know that cancer causes many deficits, both in our physical and our emotional self. And unfortunately, physical activity is one that often takes a toll. Next slide. Along with what Dr. Graff said about what ASCO recommends, I'm going to highlight the American College of Sports Medicine recommends the exact same recommendations. So not to confuse anyone, but they recommend that cancer survivors should minimize days of inactivity. And kind of what does that look like? 150 minutes per week of moderate intensity with 2 days a week of major strength training for muscle groups. And so that aligns nicely with what ASCO recommends. This can be also daunting for individuals that maybe have never stepped foot in a gym or have never took part in an exercise program. What does strength training look like? What does cardiovascular exercise look like? So I'll make sure that at the end you guys have resources to find specialists in your area to work with. And again, as Dr. Graff said, speaking with your oncologist or primary care provider is a great place to start, just to see what's available in your community. Next. The National Comprehensive Cancer Network, which the University of Colorado Cancer Center is part of, also recommends that individuals taking part in an exercise program should have tailored exercise, taking in consideration an in-depth kind of assessment to decide where someone's start point is. Risk assessment, as Dr. Graff said, making sure their white blood cell count isn't too low to partake in exercise, or that they don't have metastases to a bone that might impact their exercise prescription. They also stated that less than 50% of survivors have discussed this with their oncologists, and that most are just told to stay active. And as Dr. Graff said, the time is often limited in those sessions. And I know individuals at our cancer center get a binder full of knowledge. And so it might be days or weeks before they get to all of those sort of additional resources that help cancer survivors kind of navigate this journey and mitigate some of those negative side effects. Next. So I'm going to point out exercise and physical activity are very different. What is exercise? This is something that is planned, intentional, has structure around it, has repetition. So you may set aside 2 times a week where you're going out for a walk with a girlfriend for 30 minutes and you're going to complete that exercise. It's something that maybe you go to a gym setting for and you do strength training machines or partake in a group exercise class. But there's intentionality behind it. There's structure. There's kind of a time frame around exercise versus next slide is physical activity. And this is more just living. It's laundry, chores around the house, picking up your grandkids or your children. Things that physical activity is defined as any bodily movement that produced by skeletal muscles that requires energy expenditure. So there is a difference. While physical activity is necessary, obviously, for our daily life, exercise is something that has to be intentional and planned in terms of putting that into your program. Next. I love this slide because it kind of shows benefits of exercise during treatment. You can see on the left-hand side effects of cancer treatment, and it goes through a minimal list here. I know there's many more that individuals will experience, but these are kind of some categorized symptoms that people might experience. And then when we compare that with benefits of exercise, almost line by line, exercise can cancel out or help mitigate some of these negative side effects that one would experience. Which has brought us to our question here on our campus: why aren't cancer patients exercising? And that's what led to kind of the creation of this program almost 10 years ago now. And I'm so grateful that it's a resource here and that we're seeing other resources across the country open up for cancer survivors to have a safe and structured place to do exercise to really help counterbalance some of these negative side effects. Next. Just to tail off that last slide, cancer and cancer treatment, as we know, can result in decreased physical fitness, increased mortality, decreased physical function, and then affecting a lot of those psychosocial metrics like quality of life, fatigue, and increased anxiety, depression. And then again, exercise during and after treatment can be beneficial for individuals and can decrease and improve a lot of those negatives that we see on the left-hand side there. Next. So what does the research say? As Dr. Graff mentioned, there is a lot of research that has come out over the years. I kind of stole this infographic from the American College of Sports Medicine. It highlights how cancer can be almost preventative for certain cancer types. But there is evidence that exercise after a diagnosis of breast cancer, colon cancer, prostate cancer, it is associated with longer survival. We know that as the human body ages, we lose about 4 to 6 pounds of muscle mass every decade of life that passes. And so there's definitely a need for exercise just in a general healthy population, let alone if you're coming off of a cancer diagnosis. Exercising during and after cancer treatment has been shown to improve fatigue, anxiety and depression levels, physical function, and they have found that it does not exacerbate lymphedema or cause lymphedema. Kind of that start low, go slow mentality is a great place, especially for our breast cancer survivors, just to see how they adjust and adhere to exercise post either a surgery and or treatment. So we can see that the research is out there that shows exercise is beneficial. Next.
Okay, thank you, Nicole. We appreciate that. We're going to move to our third panelist, who is Tammy Salimoni. Tammy is an ACE certified personal trainer and fitness expert. She loves showing others the mental and physical benefits of regular exercise, and her philosophy is it's never too late to get started. She is also a breast cancer survivor who worked out consistently during her entire cancer treatment. You can find more about her on her website, thepinksurvivor.com, and her free workouts are available on her YouTube channel. Tammy?
Thank you so much. I hope that me being here today, I became a personal trainer in 2007 and then became a breast cancer patient in 2017 and now a breast cancer survivor. So I think I kind of can offer a unique perspective being in the professional industry of exercise and then kind of finding myself becoming a patient. I can go to the next slide, please. So you've been diagnosed and now what are you going to do? These are the exact questions that I started to search. As soon as I found out I was diagnosed with breast cancer, when I learned what my treatment was going to be, what kind of surgeries I was going to have, I started to just search these questions. Can I continue to exercise? Because it was so important to me. Will I ever do a push-up again? Can I continue to run through chemo? When can I lift weights again after my double mastectomy? You know, and there just was not a lot of information out there that I could find. So I'm kind of the person, if you tell me, you know, I'm not going to be able to do something again, I'm going to probably try and find a way that I can accomplish this. So I asked my doctors. They probably hadn't encountered too many people like me who were just ready to get right back out there. But mainly once I got my range of motion back, that was the first thing that I worked on, of course. And I got the approval from the doctor. The plastic surgeon had kind of given me the okay as far as with running, as long as I had a very good supportive bra on. And then I just kind of stepped back and I took it slow. And I literally went back to my 2 and 3 pound weights again. And I started to do things with, you know, very little movement where I can do things that my arms were very close to my body. And I started to do, you know, things like bicep curls and tricep kickbacks and whatever I could do. And I slowly, about every 4 to 5 weeks, just like anybody else, I would move those weights up. And I'd get back to, the 5-pound weights and then the 8s and the 10s. And I just slowly progressed my way back up. Of course, there's certain things that, I do a push-up, but is it the best push-up, that I've ever done? Probably not. And I did continue to run through chemo. My oncologist had said, whatever you're doing, keep doing it, but you're going to naturally, most likely, become fatigued and tired. And then halfway through my chemo, I became very nauseous. So I had to definitely scale it back. And there were some days where all I could do was walk, and that was okay. At least I was trying to do something, but I tried to stay active and I did the best that I could. The only exceptions I would say would be, I know that Dr. Graff had mentioned it too. If you have extremely low red or white blood cell counts, then you're probably going to want to not work out that day or until you get that back up. And also avoiding going to a big gym. I did kind of step back from going to the gym, and I worked out more at home or, followed some videos because I felt a little safer there during chemo. Also, and maybe Dr. Graff can tell me if this is right. If you're on adriamycin, they say that you shouldn't work out the day of chemo, and you should also wait 1 to 2 days before you do work out. I was on Taxol, so it was a little different from me. And as long as I felt okay, I did continue to work out. And then also, if you've been diagnosed with lymphedema, you want to take precautions and wear a compression sleeve on the side that you're affected on while you're using weights. Okay, next slide. As I got more and more into my treatment, I ended up being triple positive, for whoever is maybe familiar with that, and ended up having a year of treatment. And I became emotionally and mentally exhausted. I don't know how much of it was physical, but mentally I knew I couldn't do that much. So there were some days, like I'd said, all I did was go on an hour walk, but at least in my mind, I had accomplished something for that day. And I needed that. I needed to feel, the benefits, the mental benefits that come with exercise. So don't give up on something that makes you happy. If you love, running, maybe just scale it back a little bit. If you love bicycling or swimming, or maybe you can find something new to do, like going out on a hike, do that. Don't let yourself deny yourself of that happiness if you truly enjoy working out. Okay, next slide. What can you do in the long term? There are so many studies out there. I was just reading some from a couple days ago too, that just getting in that, start small, 20 to 30 minutes a day of doing some kind of exercise that you enjoy can reduce your recurrence rate by 50%. To me, that was so huge. And I was so excited when I read that, because to me, it's just as important as taking a pill every day. That's maybe helping you avoid that recurrence. But this is something that's literally free, something that you can do on your own time, and that can avoid a reoccurrence. And studies have also showed that if you've never worked out before and you start after your breast cancer treatment is finished, you will still gain up to 46% benefit of lowering your recurrence rate. I mean, that's just so exciting to me. You just got to find something that you love, try something new, and stick with it is the key. And the benefits, even outside of cancer treatment, are just huge that you will experience. Okay, I think that's all I had right now. And then I can answer some questions too.
Okay, thank you, Tammy, for your presentation and for all of our panelists. We have received a few questions through the Q&A section in Zoom, as well as we received some prior to today. And so we're going to throw some of these to the panelists and get some answers. So we'll use our remaining time to go through some Q&A. The first question, which came from our Q&A today, the question was, what are the best exercises and foods to improve lymphatic flow and reduce buildup? I think Dr. Graff, you wanted to answer that.
Still on mute. Okay, sorry, I was still on mute there. Yeah, sorry, can you say the question again for me, Lejeune?
Sure. What are the best exercises and foods to improve lymphatic flow and reduce buildup?
Yeah, and there's probably 3 or 4 questions, and I feel like all 3 of us, Tammy and Nicole, and even you, Lejeune, should weigh in. There's that say things like, I was told not to, or just the myths of lymphedema. And I don't know that any of us just called that out. So I'm going to do that now. It is a myth that you can't exercise or you'll get lymphedema. When people tell you that, it is based on antiquated knowledge that is not up to date. I have worked so hard to try to get that to stop everywhere I've ever worked. And it is like spitting into the wind because 100,000 people talk to my patients. Like the CT therapist, the CAT scan tech, the nurse in the hospital or the ER, my own clinic staff, other physicians. In the oncology literature, exercise does not increase the risk of lymphedema or progression of lymphedema if you already have it. There are 4 large randomized studies that show no progression or risk for patients randomized to exercise over non-exercise. Period, the end. Again, common sense reigns supreme. Start low, go slow. You can do whatever you want to do. If you want to do headstand yoga, awesome. I still can't get in that pose and I've been doing yoga for a long time. If you want to swim laps, swim laps. Are you going to swim, Michael Phelps laps on your first day back into the pool after a break or a big axillary surgery or breast surgery? No, but start low, go slow, and you can get back there. I'm not actually answering the question, which was, are there specific exercises? The best treatment of lymphedema is prevention of lymphedema, and exercise has been shown to lower the risk of lymphedema. Unfortunately, the other thing that lowers the risk of lymphedema is what treatment you have. The more lymph nodes you have removed, just a sentinel node biopsy where someone removes 1 or 2 nodes does not significantly increase the risk. We're talking about axillary dissections where patients have 10 or 20 or 30 lymph nodes removed from their armpit, okay? Taxane-based chemo.
I think we may have lost Dr. Graff for a few minutes. Does anyone else on the panel want to weigh in on this question?
Nicole, do you have any experience with the?
I can just speak from my own experience working with patients. Unlike you, Tammy or Lejeune, I'm not a cancer survivor, but we've had many women go through our program that have had lymphedema and it has not exacerbated their lymphedema at all. And it's kind of a personal preference for those that want to wear a sleeve. If it's recommended by a PT or a physician, we certainly encourage that. We kind of align with whatever the surgeon or medical professional is recommending. In fact, we have many women that experience like they feel a little bit better, like their lymphedema. Those that do have lymphedema have just a small reduction in lymphedema. I refer often to searching YouTube for like lymphatic flow exercises. It's not something I specialize in, but I know a lot of lymphatic PTs will go through lymphatic flow exercises. And so there might be some resources. Maybe you, Tammy, know more about that. I've also heard that jumping on a trampoline or kind of bouncing on like a stability ball is a great way to kind of get lymph flow. So just maybe something little you can incorporate in your exercise routine. So
I've heard that as well too, as far as the jumping and the little trampoline. And also with patients that I've worked with, it seems that some of them definitely do feel better wearing the compression sleeve. And I feel like just getting the blood flowing and getting things moving has been a huge help for a lot of them.
Great. And
I
we
think
have
Dr. Graff is back.
So
I have no idea what happened. My computer crashed. Hi, everyone. I'm on my cell phone now.
Oh, we've all been there. I will just add to the conversation about lymphedema and movement. I never really had that during my breast cancer treatment, but definitely getting the flow and the range of motion. And I exercised as well throughout my treatment time as well as after. So I never had any issues with that. And so I 100% agree with Dr. Graff in terms of exercise being, I think, better rather than worse. And if you've been told differently by your doctor, you certainly need to have the conversation with them about why that might be the case in your specific situation. A couple of other questions that have come in. One of the ones that was asked is, do I need to consult with someone about the kind of exercise I can do? And I would couple that with another question, which is how to select a personal trainer or an exercise program, like what you might want to do in order to get the best treatment program for you. Nicole, if you want to weigh in on those types of things, how do you find a good trainer? How do you know what you can and can't do?
Yeah. I think in terms of finding a trainer, on the last slide of the presentation, American College of Sports Medicine is really taking an initiative in terms of sort of collaborating with a lot of oncology specific exercise trainers and providers across the country. I put a picture there of the Moving Through Cancer. That's what the website looks like, but then you can see there's a button on that website that says Exercise Program Directory. And individuals that have a cancer specific certification through different organizations can register on this website. I know there's thousands now on there. And this is a resource that they're trying to grow so that individuals like you guys can find either specific trainers and or programs that are in and around your community. I think that's a great place to start because especially if you've never been in a gym setting, we certainly don't expect that you know how to walk into the gym and lift weights on your own. So some guidance and some structure I think is recommended, and that can really, the individual or program can really help identify exercises that would be safe for you, given your specific cancer type, if you have metastases or not, or if your blood counts are low or not. There's so many unique situations within breast cancer itself, among other cancers, that I think having an individualized and specific training program is not only important, but crucial. And finding somebody that's comfortable working with cancer. I know from my own experience working with patients, they'll seek out a personal trainer they've been working with for the last 10 years. And that individual might say, I don't feel comfortable working with you because I don't know anything about cancer. And so I think just being an advocate for yourself and asking those questions. But I do find this to be a great resource. And I'm hopeful that it continues to grow over the coming years and more programs and individuals are listed on there as resources. So.
And also I wanted to add in that there are cancer exercise specialists out there that are also trainers. And I'm part of the program called the Pink Ribbon Program, which you can look up. And then those trainers are specifically certified to work with breast cancer patients. So that might be helpful as well.
Great, thank you. Another question, and I think Tammy, you might have mentioned this in your own experience. The question was, I heard that it's better to avoid gyms and work out at home. And the question is, why would that be the case, or if it is the case?
Right, because when your red or your white blood cell count start to go down, your immunity also starts to go down. So you're resistant, you're going to easily catch maybe a cold, or especially going through the pandemic and everything too. I didn't want to actually expose myself unnecessarily. So that is important, just to avoid those large groups where you might be more susceptible to catching something.
But I think for the most part, patients on breast cancer treatment, even patients on chemotherapy, a lot of breast cancer chemotherapy regimens have a pretty low risk of neutropenia. Chemo regimens that have a higher risk of neutropenia, we're often using medications like Neulasta, Neupogen to help bring your blood cell counts up so that they're not low as you go through treatment. And what I tell patients is, as long as you keep living life like you're in the middle of a pandemic, because hey, guess what? We're still 25 months later in the middle of a pandemic, and being smart about, using sanitizer and wearing masks when you're indoors in groups. I think gyms are fine. Would I be strategic about avoiding like the big crowded times if it works for your schedule? Absolutely. Outdoor exercise is amazing. I think nature brings us lots of other benefits. But you've got to do the exercise. The best exercise is an exercise that makes you excited to do it. And if that happens to be at a gym, then find a way to make that fit back into your life.
That makes a lot of sense. A couple of other questions. We have still a little bit more time. One of the questions was, should I expect to feel weaker in one part of my body rather than others? So based on the exercise they're doing and the treatment they have, is there an expectation that you're going to feel weaker, that you're going to be more fatigued based on exercise? Any thoughts around that?
I think it probably depends a lot on your type of treatment. So for example, if you had a muscle flap breast reconstruction, so like a tram flap where we use part of your tummy muscle to reconstruct your breast, your tummy's going to be weak because we just took a piece of that muscle to move it to make breast. That's one of the cons of those types of breast reconstruction, is that it does cause implications to the rest of your body and how it functions. Similarly, if you have metastatic disease and you have disease in your left hip, I would expect your left hip isn't going to cooperate quite the way your right hip does. And so you may need to see a physical therapist once and just get some modifications to make some of your favorite exercises work for you. I'd be interested in Tammy and Nicole's thoughts.
I mean, absolutely. For me, I had my double mastectomy with reconstruction where they put in the expanders, and then I later went back for the implants. So I feel like that is probably overall a much easier surgery compared to any of those surgeries where they use a part of the muscle or some of your fat, because that is, yeah, as the doctor said, going to affect where you are going to feel weaker. And then just in general, though, I mean, there were things that were harder for me, things like doing a pull-up or a push-up and those type of things. I had to work my way back to, and you have a lot of secondary muscles that will kind of kick in. My triceps will help a little more, where my chest, maybe is not as strong, but you'll be surprised, slowly but surely we will be able to gain a lot of that strength back.
To add to Tammy's comment, I know she mentioned this in her presentation, but gaining range of motion first and foremost is crucial before you can then load any of those muscle patterns. So often for people, even if you've just had a lumpectomy or a double mastectomy, regardless of where you fall on that spectrum of surgery, I think range of motion is really important, both in the upper body, just to get good postural awareness back. We focus a lot on core strength. We believe that that's kind of a foundation to building total body strength. But I think really focusing on getting range of motion back to where it was before is really important before you then start loading a lot of those movement patterns. And it's possible that the area that was affected is going to be weaker. It is going to not move as well. And so just being patient with yourself to work through those movement patterns to regain the movement.
And I would add to that, having gone through that, I had a muscle taken out of my shoulder, the back of my shoulder, as part of the reconstruction. I'm almost 3 years past that, still don't have really full range of motion. I do work with a trainer regularly, and we focus on exercise that helps to stretch that area, but it's probably always going to be an area that's different from the rest. So the patience part of it is key, because you're not going to just bounce right back. It's just going to take some time to do that. Couple of other questions. Someone wrote in, I exercise twice a week. Will exercising more during treatment help my body heal more quickly?
I do want to say one thing on that. I mean, I'd love to see maybe if you could add in a third or fourth day to that. But of course, you've got to go with how you are feeling and how fatigued you're feeling throughout your treatment. And as it progresses, you might be feeling really great at the beginning, but start to get quite tired towards the middle and the end. There was something else I was going to add to that. You said if I add extra.
Will they heal more quickly?
Oh, yes. So yeah, very interesting is that when I would go to the plastic surgeon, I would be, let's say, 8 weeks out from my second surgery, and he'd come in and he'd say, oh, what has it been? 12, 15 weeks. And I'd be, no, it's actually been 8. So multiple times I was healing quicker. And I do believe that my exercise and continually just moving, like I said, had a lot to do with that. So I was able to bounce back on those days where I felt nauseous from chemo much quicker than I saw other women in my chemo group doing. And also I was healing a lot quicker.
I think exercise is a gray scale. And when we do studies, we have to we can't say we're going to have one group exercise a day a week and another group exercise 2 days a week and another group exercise 3 days a week and on and on and on, because there's a limited number of people and time and resources to do clinical trials. So we tend to be sort of all or none in our approach to research questions. But my guess is that people who exercise 5 days a week are getting bigger benefits than people who exercise 3 days a week, who are getting more benefits than people who exercise 1 day a week. But I don't think that any amount of exercise that you can add to your life is wonderful. And I would just focus on that. Especially as you go through cancer treatment, it can be overwhelming to kick cancer's butt and then also decide to pick up a whole new exercise program and learn to speak French and crochet. And I mean, it's not the time to revolutionize your life.
Just to add to that, I think exercise is kind of a general term. And when we're talking about exercise, doing 5 days a week of strength training is not something I would recommend. So making sure that you incorporate rest days in between strength, but that doesn't mean you can't get outside and do a walk or get on a bike and or a yoga session. So kind of thinking about exercise in multiple forms and how you might sprinkle that into your life, I think is also beneficial. Some studies that we've seen recently have shown that 2 days a week minimum have shown clinical benefits in terms of strength gain. So that's usually our recommendation from a minimal standpoint in terms of adding in strength training, in addition to the cardiovascular exercise that you might do, walking, biking, running, etc.
Okay. And just kind of a follow-up to that, another question was, is there anything extra I should do for recovery after exercising?
Oh, that's kind of interesting as well. For me, I noticed as I was going through treatment, and even now, years later, a warm-up has been very important for me. I need a good warm-up before I can start any kind of weightlifting or whatever I'm going to do that day. And also a little cool down and some more stretching. So it's probably age-wise too, just getting older. I've probably needed it more, but I definitely noticed it through treatment, and after I've continued with that solid warm-up and cool down.
I would just add, especially if you're on chemotherapy, to really focus on hydration, and maybe even protein intake in your diet. I think that most women that I meet, either in my life outside of doctoring or as a breast cancer physician, are not drinking nearly enough water. They just don't. And even my patients on chemotherapy who tell me that they're really pushing fluids, I give them a liter of saline and they're like, oh my God, I feel great. I'm like, yeah, because you were dehydrated. One of the cancer exercise therapists I used to work with had a t-shirt that said, all of your problems are that you're not drinking enough water. And I really loved that and feel like I should wear it to clinic some days. So water, 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 and then some more water.
I think movement in general can help from a recovery standpoint, both if you're sore from exercising the day before, incorporating water, as Dr. Graff said, but just movement in general. Often our patients feel better if they just get up off a couch and walk for 10 minutes versus just being seated all day. So
Makes sense. A little different question. How should we protect ourselves from sun sensitivity when walking outside? This person's currently in chemo treatment and would like to return to their walking routine soon, but wants to know how they should protect themselves from the sun sensitivity.
Yeah, I would just wear good sunscreen. You may have to, people's sun and skin sensitivity changes a lot as they go through treatment. So you may have to play around with brands to find the sunscreen that works best for you. And in addition, I would, wear hats, even wide brimmed hats. They're cool now. Those SPF sun risk reducing shirts. They make so many now that sort of wick sweat and keep you cool, although they can protect your skin. All are really good. Pale is the new wonderful, says the pale blonde on the call here.
Okay. Just check in the chat for other questions here. Here's another one. Is there a specific time around your treatment schedule that is best for working out?
Probably not. I mean, I think, again, specifically for chemotherapy, the day you get chemo is probably a long day. You're probably going in and spending 6 or 8 hours at your chemo infusion center. And it's okay that you don't exercise that day. Please take the day off. And if people are going to have low blood cell counts, it's normally in the 7 to 10 day window after an every 2-week regimen. With a lot of the weekly regimens, they don't even have low blood cell counts. So maybe avoiding the gym in that window. Normally when people's blood cell counts are low, they feel extra tired. So again, common sense reigns supreme. Listen to your body. If you're pooped one day, it may be your body's way of telling you to take the day off. But I don't think that in terms of like day before, day of, day after, that there's any sort of logic that, Monday, Wednesday, Thursday is the optimal exercise schedule or anything like that.
Nicole, did you want to weigh in on that?
Similar to what Dr. Graff said, it's gone 50-50. We have so many patients that say, I can't imagine working out during chemo. And the other 50% say, I can't imagine where I'd be if I wasn't working out. We usually just encourage patients it's kind of a personal decision as to when to start. But we certainly recommend starting, just kind of depending on how you're feeling and what makes sense with your lifestyle and your work schedule and that sort of thing. So.
And for me, just on a personal note, I mean, I did work out every day, and I would do something before my chemo treatments because I knew once I went into chemo, I was going to be exhausted for the rest of that day and probably just be sitting on the couch. So for me, I felt good enough that I could get a little something in, but yeah, you definitely have to play that, based on how you are feeling. And like I said, you will probably adjust throughout your treatment as well. But if you feel like doing a little something, I say do something.
And I think we have time for maybe one or so questions. Here's another one. Does the association with longer survival apply for metastatic breast cancer also?
Yes. Better outcomes, longer time on treatment, less toxicity with chemotherapy, all linked.
Okay. Any recommendations for exercise during radiation treatments? Any differences if it's radiation they're going through?
I'm not a radiation oncologist. Your skin and your breast are just going to be more tender, especially, now we can so often do radiation like in 5 days and it's super quick and easy and people have very minimal skin reaction, but especially patients on like a 6 or 7 week course of radiation, toward the end of that radiation, they're probably going to have pretty substantial fatigue and skin toxicity that even just motion in their breast that would result from something as simple as walking in a sports bra may be yucky. And so I would listen to your body. But other than that, there's no specific differences. Nicole?
I would exactly couple with what you said. We've experienced that where patients come in and they don't want even a sports bra touching their skin. So we would just be accommodating by not doing like high intensity exercise where there's a lot of movement there, or any kind of pressing up against. So maybe no prone exercises where you're lying on your chest or stomach. Yeah, I think every individual is so different with how they handle that and what their comfort level is. But no specific exercises that we would avoid. Kind of take it case by case.
And I did not have radiation, so I can't speak from personal experience, but patients that I've worked with who have, they do towards the end, their skin has become so sensitive and burned that they can only have very lightweight materials touching them. So they're probably not going to be able to definitely wear anything like a sports bra. And they did become very tired towards the end of their radiation, so they had to back off on their exercise routine.
Okay, and then we'll take this as our final question. Any recommendations or concerns for getting back to competitive sports?
Well, I would just say, I would just take it slow, and I would be talking with my doctors along the way, and I would just slowly work my way back up and see how you're feeling. Anything's possible. I mean, I've run a 10K and things like that, things after that I didn't think I would be able to do. So I think that, as long as you're having the guidance and with your doctor, that you can work your way back up to it.
Yeah, my guess is as a competitive athlete that you were a competitive athlete before your breast cancer diagnosis. And so, I'm not going to become a competitive athlete after going through an extensive medical diagnosis because I'm not one now. But if you were a competitive athlete previously, I think you're going to work with your coaches and your trainers that are a part of the competitive program environment that you're in, and have a similar recovery that a non-athlete would have, probably even better, to get back to that peak fitness. I do, everybody's talked about limitations in the range of motion. So depending on what your sport is, I'm thinking of like a softball pitcher, for example, like, wow, that would be really hard. So there may be some times where that is really hard.
And I will say I played tennis prior to breast cancer, having had the mastectomy on my right side. I'm right-handed. It's taken me forever to get back to being able to even like normally serve. And then I remembered I was terrible at serving beforehand anyway, so I've kind of gotten over it. But I tried to work with a trainer to have specific exercise to just strengthen that side and stretches and that sort of thing. So it's just going to go slowly. But there was never any. The doctors never said, "Oh, don't compete in sports again." I think it's a timing thing and really focusing on exercises that help that particular area that's going to be used the most. So that's our final question. Sorry, we're kind of out of time. I want to thank again Dr. Graf, Nicole Gleason, Tammy Salimoni for joining us today and for presenting the information. It was very helpful for everyone. If you have any questions that were not answered today or would like to get in touch with the foundation about what was presented or any of our research initiatives, please email info@drsusanloveresearch.org. Today's webinar has been recorded and will soon be posted to our website, which is linked in the chat box for your convenience. I also encourage you to visit our website if you are interested in learning more about the foundation or making a donation in support of our research. I'd like to thank each of our panelists again for joining us today and hope all of you are staying safe and healthy.